Welcome to Family Health by Mini First Aid. Mini First Aid are the UK's leading family first aid provider, and we are delighted to bring our latest podcast series to you, giving you all the information that you need around family health subjects. Thanks for joining. Series 1 of Family Health by Mini First Aid podcast is sponsored by Savlon Scar Prevention Gel. Savlon Scar Prevention Gel helps soothe pain, promote faster healing, as well as reducing the risk of scarring when used on minor wounds, superficial burns and grazes. With 6 children in my house, scrapes and cuts are plentiful, so my first aid box saviour is Savlon Scar Prevention Gel. Hello everybody, I'm Kate Ball, the founder of Mini First Aid. Welcome to our podcast, Family Health by Mini First Aid. It is great to hear that you've been enjoying our new Family Health podcast series, and we continue to bring you lots of top family health advice from leading experts. So I am delighted to introduce our guest today, the lovely Lowri Hext. Lowri is a Mini First Aid trainer sharing our Swansea franchise with her husband Ryan. This incredibly busy lady is also a GP and a mummy. So Lowri, I'm surprised you've even got time to chat to me today, but thank you very much for joining us today.
Thank you so much, Kate. It's lovely to be in. Thanks for the welcome. Thanks for the invite to do the podcast today. And just to warn everybody, my toddler's currently asleep upstairs, so I'm hoping, fingers crossed, that she's going to stay asleep. But otherwise, we may have another guest speaker coming soon.
We all love a sleeping baby. We love a sleeping baby. So, Lowri, can you tell everybody? Obviously, we've done a little bit of an introduction there, but tell everybody about yourself and what you do.
So, yeah, I'm Lowri. I currently live in South Wales with my husband Ryan and my daughter, who's not far from turning 2. I've got a couple of roles at the moment. So as well as being a mum to a little one who is keeping me busy, I'm also a franchise owner of Mini First Aid Swansea, the Vale and Valleys. And I'm also a doctor. So I'm currently working as a GP. Just a little bit of background in terms of why I got involved with Mini First Aid. So probably about a year ago now it was, I'd been involved in a couple of situations that needed first aid. And I was there thinking, I really need to make sure that I'm up to date with my knowledge because I'd been on maternity leave. And off I went on a mini first aid course that was run by one of the neighbouring franchises. And I was sat there thinking, this is really good. It's a really good course to be on. And I thought afterwards, I'd love to get involved. So got in touch with Mini First Aid, and a couple of months later we got involved. And since then I've loved being able to teach first aid and loved being able to share my knowledge and experience. So as I said, the other role I've got is that I'm a GP. I qualified back in 2011 as a doctor, and the last 6 years I've been working as a GP, which, as you can imagine, is quite a challenging but also fulfilling role.
Oh, it's fascinating. And I don't know when did you get any time to go to sleep? Does it ever happen?
These days I'm not going to sleep until about midnight, to be honest with you. But yeah, I do grab it when I can.
Well, do you know what's fascinating to hear is obviously that you joined us as a first aid trainer, having seen the other side, the medical side of why sometimes people present having, needed first aid, or perhaps first aid could have changed the outcome for people. So it's brilliant that you've joined us as a first aid trainer. But today we've invited you to chat to us about your experience as a GP, because we often hear from parents and families asking questions ranging from when it's appropriate to call a GP, or is 111 better, or how is it better? How is it best to get the most out of a GP appointment? Can I waste my GP's time? Is that allowed? Will my GP be cross with me? All those sorts of things. And I guess perhaps the media doesn't always do GPs any favour, in the sense of sometimes GPs can be misrepresented in the sense that there's complaints, or there's, it's pointing the finger at GP services, when actually that's probably not representative of the whole GP community. So we're just fascinated to hear a little bit from you. So, what do you see, I guess, is the experiences from people wanting to contact a GP at the moment?
Yeah, I mean, as you say, it's been really challenging last couple of years, and we've had to go through a lot of change, especially since COVID, with how we've been offering our appointments to patients. But on the whole, people have been really grateful to us and have been really supportive of us. We do have the odd, consult, which is difficult because people are finding it difficult to get appointments at times, but we are doing our best. But those questions you mentioned are good questions to be asking, when should we be getting emergency help? When should we be contacting 101 and when should we be using GP? So hopefully today we're going to be able to cover some of those things.
Brilliant. Well, tell me a little bit then. So on a day where you are Lowri the GP, tell me what a typical day looks like for you.
So what I would say is no 2 days are ever the same. Even though on paper it looks like we do similar things over and over, I would say that every day is different. It's variable in terms of who comes through the door. It's challenging and it definitely keeps you on your toes. When I get into work, I normally start off by having a quick look over my clinic list to see who's likely to be coming in and have a look at their notes. I'll then do some administrative tasks. So there's a lot that goes on behind the scenes, varying from having to look through investigation results, blood results, x-ray results, queries about medication, signing scripts. And then once you've done as much as you can from that side, clinic starts normally around 8:30, 9 o'clock. And then the clinic will run for about 3 or 4 hours. At the moment, I'm seeing mostly face-to-face appointments, so people who are actually coming into the building. But we are still offering telephone calls and e-consultations to those who find that a bit easier as well. And then once that morning clinic is done, I'll then do some more administrative work, such as patient referrals, and try and grab a cuppa somewhere in between before then heading out on some home visits. I get the home visits done, try and grab some lunch, and then clinic normally starts again in the afternoon around 2:30, and it's a similar structure again, about 3 or 4 hours depending on how many patients are coming through the door and whether some of those are more poorly, and then finish off again by doing some more admin tasks then.
So you see and speak to a lot of people in a day?
Yeah, an awful lot. So at least I'd say 30 patient contacts on an average clinic. So that's at least 30 people face to face, yeah.
Crikey, that's a lot of people. So for families, parents, carers, grandparents, what are the circumstances when a parent, carer or grandparent should contact their GP? And when is 111 more appropriate? And then what circumstances really should trigger that 999 call?
Okay. So the NHS website has actually got a really good summary on this if ever you're sort of thinking, oh, what was that again? So what I would say is 999 is for your life-threatening emergencies. So your things like your suspected heart attacks, your strokes, severe bleeding, choking, breathing problems, and so on. During your working hours, Monday to Friday, if you've got something that is possibly urgent but non-life-threatening or a routine inquiry, then you need to get in touch with your GP. And your GP practice should have their working hours on their website, as well as some information about how it's best to get in touch with them, how to go about making appointments, because every GP practice has got slightly different systems. And then outside of working hours or bank holidays, you should be getting in touch with 111. So that's dialing the number 111, and that puts you through to the out-of-hours service. Again, you should be using that provided that it's not a life-threatening emergency. And that service is set up to try and get people the right advice and treatment when they urgently need it. Okay.
So there's been a lot in the media about the pressures on NHS, times, getting through, that sort of thing. And there may be some of us that perhaps feel a bit anxious that they don't want to bother. They don't want to be trouble or make a fuss. So what would your advice be to people who think like that? Or maybe I won't bother because it's too much of a fuss.
Yeah, and I completely understand where that line of thinking is coming from at the moment. But from a personal perspective, I always try and assess, particularly an unwell child. So if you're a parent or a carer worried about your child, then I I do want to know about it. If that little instinct of yours is saying something isn't right, then do get in touch. I'd much rather be able to see the child and assess them and hopefully be able to reassure you than have you at home worrying about your child and not knowing what to do and potentially missing something as well.
Yeah, okay. I think that's it. I think it's just this. I think the media's not done any favours, has it? Because it's sort of that, you know, that there's people going for unnecessary reasons.
Yeah.
But I guess it's that trusting that inner instinct. And in fact, that's been really common across our family health podcasts, is when we've been talking about all sorts of ailments, is this instinct of knowing what's normal and what's different, or what's different for your family member.
Yeah.
Now, this might sound a little bit extreme, but obviously we talked about in a non-emergency situation, we're going to book a GP appointment for routine health concerns. What can I do? Because I know that I'm not going to get a huge amount of time with you in the appointment. What can I do in preparation so that I get the best out of my appointment with you or my GP?
Okay. So what I would say is it's really helpful if somebody can give me a really good summary of what's been going on recently. They don't necessarily need to go as far as making notes, but giving things a little bit of thought before going into your GP practice can be helpful. When I start off my consultation, I always do give something called an open question. So that allows somebody to tell their story, and I give them some time to just summarise what's been happening. If you can be quite specific during that time, that's always helpful. For example, if somebody says something's been going on for a while, how long is a while? That's not really helpful. So if somebody can be a little bit more specific, and I know that's not always possible, but saying actually it's been going on for the last 2 weeks, then that narrows it down a little bit more for me. So that is really helpful. It's also helpful that I know where somebody's mind at and to know what they're worried about. So if you are worried about something specifically, so often people are worried about things like cancers, I'd like to know about it. I'd like you to tell me this is what I'm worried about. So hopefully that then I can reassure you or advise you about where we go next with that worry.
Oh yeah, that's it. I think we almost know too much, don't we? And
absolutely.
I would guess that sometimes people spend a bit of time looking on Google before coming to an appointment. Is that helpful, or could that be that then they've diagnosed something or think they've got something that they haven't?
I like to know about it if you've been on Google, mainly again to know where your line of thinking is at and to be able to think, why have you gone down that route? And sometimes, you know, I've had some weird and wonderful things and I've had to turn to Google myself thinking, what is this? But equally, sometimes it does go too far and people don't know where to look and which websites are the ones that are useful and the ones that are actually giving you accurate medical information and the ones which are not, which is where it can sometimes be a little bit unhelpful.
So actually you mentioned the word unhelpful. What do us parents do that's not very helpful for the GP? What should we avoid doing? What will help the GP the most?
To be honest, most parents who come through the door are absolutely fantastic with their children. They walk in, they say, you know, they're reassuring their children that they're going through, and they're setting that example of this is how you need to be, and that is really, really helpful. Little sort of things that I find speed things up, because again, we're under time pressure during our consultations, is not coming in with too many layers on. So I do know in the winter you need to wear your coats and your gloves and so on, but maybe take them off before you come into the consulting room, because I normally do have to examine children. So having to take off all of these extra layers does take some time, and then at the end they're putting them all back on and you're thinking, right, maybe do that outside. That would be helpful in just speeding things up a little bit. The other thing that I've made an observation of, and I don't know whether all doctors would agree with me, but I have noticed that the children who role play at home with their parents or carers, the ones who have their doctor kits at home tend to be more prepared to allow me to examine them. So I find that is really helpful. If They're not afraid when they come in. And they say, oh, we've got one of these at home, when I approach them with a stethoscope. So then they're not afraid when I'm coming up to have a listen to their heart, or not afraid when I'm trying to put the thermometer in their ear. So role play is really helpful, and having those kits at home are really helpful in making the consultation a little bit less scary. So I've done that with our little one as well. I've bought her little kit to have at home, and now she's doing her own imitations of listening to the heart going boom, 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 boom. So that's a little handy tip I found.
You know, Lowri, in our house, we love it if I'm the patient, because then I get to lie down. That's the great parent hack, is you play doctors and you lie down and let the children be the doctors, but also on their teddies and what have you. That's really helpful.
Love. The children often go, can we have a go on you? And I'm just like, yeah, you can have a quick go if you want.
Brilliant. Sometimes, obviously, parents who are anxious that something might have been missed, or they might want to get a second opinion, and you just get home, or maybe you get home from the GP and something's got worse. What are your next steps if you were to feel that, having come out of the GP appointment, you don't think that everything has been resolved?
Okay. So at the end of the appointment, I give the patient something called a safety net. So this is advice that I give in terms of what to look out for in terms of if things are getting worse, as well as what to do if things are getting worse. Okay. So we've got a specific amount of time that we will see and assess the patient over. And I'm very aware that things can change. So it's really important that if you are worried that things are changing and things are getting worse, even if it's 20 minutes later, half an hour later when you're getting home and you're thinking, this isn't right, things are getting worse, things are changing, things are deteriorating, or even if your gut is off thinking, I'm still not happy with this, we want to know about it. So please don't be afraid of coming back and being reassessed and getting a second opinion, because that is really important. And I wouldn't want you to sit at home thinking, I've had that assessment this afternoon, I can't possibly go back. So do come back for a second opinion, and do come back if you're worried that things are going downhill.
How can we make parents feel, well, all family members really feel really empowered to ask that question, so they're not nervous to, perhaps if they have to speak to a GP receptionist, for example, who might say, well, you've had an appointment already. What can we do to reassure them that it's okay to come back?
Just saying, I'm a worried parent. I am not happy. Okay. My child is unwell, and that should be enough to say, actually, something's not right here. Let's have another look at you. And, normally I have something called a rule of three. So if we've assessed a child 3 times and you're still thinking, am I missing something? Then normally I would then refer into the hospital to get another opinion, or ask another doctor to have a look to say, what am I missing here?
Is that quite common for you to send children on to hospital for further investigation?
We try and avoid it if we can help it, in terms of sort of helping the hospitals, but you do need to do it if a child's particularly poorly, or if you're thinking something's not right here and I can't quite find exactly what's going on, then referring into the hospital for a second opinion is generally what I would be doing.
And it's happened to us. It's happened to us where we've been to the GP and, and it's that there's maybe, I know we had one occasion where an ECG was required and it was like, actually, you've got to go. And, and I think that can be quite scary sometimes for families. If you get told, actually, what I need you to do is jump in your car now and take your children down to A&E or to an assessment unit. But I guess that's the GP saying it's the next step. It's what, we need to know. Okay. Yeah. I'm always intrigued with children particularly, but just in general, is without naming any names clearly for confidentiality, can you tell me about some of the strangest things you've encountered as a family GP? Do children really come in with Lego up their nose, or is that just a myth?
I don't think I've had any Lego up the nose. To be honest with you, the more weird and wonderful things used to come in when I was working in A&E, because when we do our training, you do rotations. So you do A&E rotations, paediatric rotations, and so on. So when I did my A&E rotations, we used to get a lot of things like small beads coming in up the nose, or peas. I don't know why, but peas used to be a common one that used to be stuck up the nose, and we'd have to sort of see what we could do to get it removed. in GP, because most people would be sort of heading towards A&E, you don't tend to see as much of that. But I suppose one of the strangest things that's come through the door was a mum of a child who was worried about a rash on her little one's body, and it was blue. And she was getting quite worried, thinking, what causes blue rash? This isn't right, But he was otherwise completely well, completely fine. I had a look at this rash and thought, I wonder. So I got a little bit of alcohol wipe out and put it over this blue rash, and off it came. So it turned out that it was just a little bit of ink that had just covered his body, and he failed to tell his mum that he'd been sort of playing around with some biros, and caused his mum a little bit of worry, but he was absolutely fine.
Gosh, I think rashes are, we've actually been chatting as part on this series to Sepsis Trust and Meningitis Research Foundation. So rashes are a big bugbear, big worry for parents, aren't they? They teach us to
especially if they're
worry.
Blue.
Yes, especially if they're blue. Then you go, actually, that's not anything that's presenting as any of the illnesses that we recognise. Gosh, a blue rash. Well, who knew? Who knew? Okay, so you are the GP, but you're also a mum as well. So what happens when a doctor needs to take their child to the doctor? Who do you see?
So it's essentially the same setup. So the policy around here is that we can't be patients in the same practice as where we are working. So we have to sort of be set up in different practices. But it's the same system that we follow, but it's hard sometimes to get that balance right between being a mum and being a doctor. So I have to tell myself sometimes, if my little one is poorly, that I need to maybe sort of go towards being a mum and allowing someone else to make that clinical decision on my behalf, because I sometimes find that knowing a little bit, having clinical knowledge can actually lead you to be a little bit more anxious sometimes as well. So you think, oh gosh, she's got a temperature, right? What if this happens or that happens? And you think, actually, just take a step back, just be a mum and go see your own GP. And they're pretty fab, and they do the assessments then and usually reassure you.
Do you think becoming a mum changed the way you sort of did things in practice? Or the way you were as a GP. So what changed?
I think patience was one. I suppose because our days are so busy, then you try and run to time as much as possible. And I used to find, that people who were turning up very late and things were causing a bit of delay. But now I appreciate that sometimes as a parent, you cannot get through that door because little one's had a dirty nappy, they need a change of clothes, and you're going to overrun and you're going to be late. So I've been far, far, far more patient these days with late people coming in late for their appointments, especially with little ones. And also within the appointments themselves with little ones, being able to interact with them better and going down to their level, making sure that that they're not scared or intimidated during the consultation as well is really important, because once they become afraid, once they're tearful, it's so hard to carry on then. So making sure that it's a nice calm environment and making it more sort of an environment that they can play around in and be happy in.
Lowri, have you seen more anxiety in people post-COVID, health anxiety? Is that heightened, do you think, now? Do you see that more in your patients?
I would say during COVID, during the COVID pandemic, there was a lot of anxiety. Mental health generally is on the increase anyway, but I don't know whether that is more so to do with increasing awareness as well around it. I think it seems to have settled a little bit more since the lockdowns have released again. People can interact again, and the anxiety seems to have gotten a little bit easier. But mental health is a common consultation that we are having to deal with on a day-to-day basis.
Gosh, and you think back to COVID times and how we feel like we're out of it, don't we now? But how things were so different. How did it affect you as a GP? What did you have to change in your practice?
So initially, almost overnight, we changed from being fully face-to-face in terms of seeing people, and we took on what was called e-consultations at the time. I don't know whether you've come across them, but you go online. go through a
Yes.
series of questions. So we went across to doing e-consultations, which again was a learning curve because, it was a different way of practicing, and you don't want to have to take on extra risk. So you're trying to make sure that you're being thorough within your consultation. So having to adapt to that way of consulting was quite tricky. The other thing that happened to me during COVID was I became pregnant. So again, worries around catching COVID were heightened because
Of course.
I was under the vulnerable group. So I ended up for a period of time in my third trimester having to work from home. So I was actually doing telephone consultations from this room, this office, during COVID times in my scrubs and heavily pregnant, so trying to sort of reduce the risk of catching it myself.
Gosh, it's massive change. Are you still in scrubs in this practice now? Or are you back into normal clothes?
So I've stuck to scrubs, mainly because I quite like the thought of getting up in the mornings and not having to think of new outfits to have
What
to
to
wear.
wear.
It's a convenience thing. But some of the GPs have gone back to just wearing their usual clothes as well. But I think I'm going to stick to scrubs for a little bit longer.
That's great. That's great. Lowri, I've got a final question for you. From chatting, and you sound so calm, which is always lovely. And that's the sort of GP in your mind that you want to have, is that someone's calming and talks very gently and practically to you. If families are listening and they've perhaps been concerned about seeing their GP, or perhaps, maybe been a little bit unhappy with an experience or what have you, what would you want them to take away from hearing us chatting today about GP services?
So top couple of things. I'd say if you're a worried parent, a worried carer, trust your gut. We take parental concern into account when we assess children. So if your gut is off, please get a medical opinion about that child. Don't be afraid to come back if things are changing or worsening. We want to see you if that happens. If it's outside of working hours, get in touch with 111. And if there is something in particular you're worried about, so, at the moment there's a lot of coverage on the media about things like sepsis. If you are worried about something like sepsis, you need to be saying, I'm worried about sepsis. We want to know where your mind is at, so that either we can act on it promptly and treat it if need be, or reassure you and say, no, it's not this, and these are the reasons why.
Okay, that's great. That's really helpful. I think just that worry, isn't it, for all of us, that we're trying to second guess for our children, for our family members. And I guess because we see so much more on the news, in the media, across social media, is that I guess we have this heightened sense of things could be worse. And quite often they're not. I know, sometimes children just get, adults do as well, but children just get poorly, don't they?
Yeah.
And so it's really reassuring. It's really reassuring that what you've had to share with us today. And then, of course, you take that and you apply that to your first aid teaching as well. So
Absolutely.
Yeah, so you're teaching. Do you find that because your first aid, people attending your first aid classes know that you're a GP, that sometimes you might get someone that says, oh, can I ask you a quick GP question? How do you manage that?
So I have to draw the line, and I have to be very careful not to give too much in the way of medical advice in that setting. So happy to share, clinical knowledge, but I'm not there to be diagnosing. So if there is anything that anybody pulls me aside and says, can you just check this or check that, I have to say, look, you do need to go back to your usual GP to have a look at this. But I love being able to share experiences, share knowledge in the classes, and I find that people like the fact that I have got a health background because they appreciate that I've actually had real life experiences, and they find that is quite often handy, that I can say, yeah, I've done this in real life, and they like to ask me a little bit more detail about that, and I share that in my classes as well. But what I often say to parents in my classes and carers in the classes is, look, it's not your job to be trying to diagnose conditions. It's your job to try and recognise when your child is ill, and to know what to do when that happens and know where to go.
Brilliant. No, that's brilliant. Thank you so much. It's been really, really insightful. And I know that it will be so helpful to families listening. So thank you so much, everybody, for listening to our Family Health podcast today. Keep following us, or join us if you're not already, on our social channels. Subscribe to our newsletter to get the latest updates on all family health issues, but also to give you the updates on our latest episodes of this podcast. If you want to watch the full video of Lowri and I chatting together, then if you jump to YouTube and search for Family Health by Mini First Aid, you'll be able to watch the video of Lowri and I chatting today as well. And if you want to continue listening to the Family Health podcast series, it's on all your usual podcast hosting platforms where you choose to get your podcast from. And I should mention that if there are things that you would like us to talk about on family health, please do get in touch. We have a wealth of individuals like Lowri who support us with their knowledge and their expertise, and we would love your input on what you would like to hear next. So thank you, Lowri. Again, we've managed to chat in a whole nap time without Liv waking up, and I'm delighted that you were able to join us today. Thank you so much, and thank you to all our listeners.
Thank you so much, Kate.
Thank you for listening to Family Health by Mini First Aid. I hope you found our podcast really useful and informative. If you want to know more about Mini First Aid classes, courses, qualification courses or first aid supplies, please do visit minifirstaid.co.uk or look us up on all your favourite social platforms at Mini First Aid. I take Savlon Scar Prevention Gel everywhere with me so that I'm always prepared for the many little and sometimes bigger accidents that my kids encounter. Thank you again to Savlon Prevention Gel for sponsoring Series 1 of the Family Health by Mini First Aid podcast.